5 surprising risk factors for cardiovascular disease. When we talk about cardiovascular disease, the focus often centers on well-known risk factors like high blood pressure, high cholesterol, and smoking. However, research indicates there are lesser-known factors that significantly impact heart health. At the U.S. Health Guide, our mission is to empower readers with knowledge. This report delves into 5 unexpected risk factors for cardiovascular disease, offering scientific insights into how they affect this vital organ and what preventive measures you can take. Understanding these complex connections is crucial for maintaining optimal heart health. Surprising risk factor 1: sleep disorders. The quality of our sleep is often underestimated in its role in cardiovascular health. Chronic sleep deprivation or disrupted sleep, including conditions like sleep apnea, can place significant stress on the cardiovascular system. Sleep apnea, a condition marked by repeated breathing interruptions during sleep, is often undiagnosed, but is a major contributor to high blood pressure and irregular heart rhythms, especially atrial fibrillation. When the body experiences continuous sleep deprivation, it maintains a heightened state of stress, leading to elevated blood pressure levels. This prolonged stress forces the heart and blood vessels to work harder. Chronic sleep deprivation also increases the levels of stress hormones like cortisol, which can contribute to the development of cardiovascular disease and promote systemic inflammation, a key factor in the buildup of plaque in the arteries. Furthermore, insufficient sleep can disrupt appetite-regulating hormones, leading to weight gain, a known risk factor for heart disease and diabetes. Untreated sleep apnea can trigger irregular heart rhythms, particularly atrial fibrillation, further escalating cardiovascular risk. Notably, even minor shifts in sleep schedules, such as a 1-hour change for daylight saving time, have been linked to an increased risk of heart problems and heart attacks, suggesting the immediate impact of sleep disruption. Studies have documented a 24% increase in heart attacks after the spring forward in March, and a 21% decrease in heart attack risk with an extra hour of sleep in November. This highlights the heart's sensitivity to sleep stability and implies that shifting across time zones, working rotating shifts, or having inconsistent sleep schedules can silently contribute to cardiovascular risk. The constant fight or flight state induced by chronic sleep deprivation isn't just a feeling of stress, it's a cascade of physiological responses. Elevated heart rate, constricted blood vessels, and persistently high blood pressure damage the cardiovascular system over time, accelerating wear and tear. Sleep is a crucial regulatory period for the body to repair and reset. Disrupting this process leads to chronic physiological stress, forcing the heart to work harder constantly and fueling inflammation, which are direct pathways to heart disease. This underscores that stress management isn't just about mental well-being, but also about ensuring full physiological recovery through sleep. To protect your heart, prioritize getting 7 to 9 hours of quality sleep each night. Improve your sleep hygiene by maintaining a regular sleep schedule, creating a dark, cool, and quiet sleep environment, avoiding stimulants before bed, and reducing screen time. If you notice loud snoring or suspect sleep apnea, consult a doctor for a sleep evaluation. Screening for sleep apnea, especially in patients with unexplained hypertension or arrhythmias, becomes critically important. Treating sleep apnea can concurrently address multiple cardiovascular risk factors, offering a powerful, multifaceted intervention for heart health. Surprising risk factor 2: the oral systemic health connection. The link between oral health and cardiovascular well-being is frequently overlooked. Gum disease, or periodontal disease, isn't just a localized dental issue. It's recognized as a risk factor for heart problems. Research suggests that gum disease can increase the risk of cardiovascular disease by 20%, and that individuals with gum disease are 28% more likely to experience a heart attack. Poor oral hygiene allows bacteria, particularly those that cause gum disease like Porphyromonas gingivalis, to thrive. These bacteria can then enter the bloodstream through inflamed gums, Once in the bloodstream, these oral bacteria can trigger widespread inflammation throughout the body. Inflammation is a critical process in the development of atherosclerosis, where fatty plaques build up in the arteries, leading to narrowing and hardening. Inflammation from dental bacteria can directly lead to an infection of the heart lining, known as endocarditis. Bacteria can also contribute to clogged arteries, heart attack, and stroke. This elevates oral hygiene from a purely aesthetic or localized health concern to a fundamental component of overall cardiovascular health. It suggests that medical and dental professionals should collaborate more closely, as treating gum disease could be a significant yet often overlooked intervention for heart disease prevention. Emerging research even suggests that oral infections in children could be a modifiable risk factor for adult cardiovascular disease, linking early dental disease to later atherosclerosis. This indicates that the impact of oral health isn't solely an adult concern. Underlying issues in youth could predispose individuals to heart problems decades later. This suggests a cumulative effect and emphasizes the importance of early intervention. This implies that public health initiatives aimed at reducing heart disease should consider robust oral health programs for children, as these could offer long-term cardiovascular benefits. Maintaining good oral hygiene is crucial to prevent these systemic risks. This includes regular brushing, flossing, a healthy diet low in sugar, and avoiding tobacco. Regular dental checkups are essential for early detection and treatment of gum disease. Surprising risk factor 3, the heartache of loneliness. Feeling lonely or socially isolated can significantly increase your risk of heart disease and stroke. The CDC identifies social isolation and loneliness as widespread issues in the U.S., posing serious threats to both mental and physical health. Approximately 1 in 3 adults report feeling lonely. Loneliness is linked to increased stress. Lonely individuals may lack a support system to help them regulate emotions, leading to chronic stress. Chronic stress elevates heart rate, blood pressure, and stress hormones like cortisol, contributing to plaque buildup and increased heart disease risk. Research shows that social isolation and loneliness are associated with higher levels of proteins linked to inflammation, viral infections, and immune responses. Specifically, loneliness can directly trigger an increase in proteins like ADM, associated with stress responses and a higher risk of early death, and ASGR1, linked to higher cholesterol and an increased risk of cardiovascular disease. While loneliness is often viewed as a purely emotional state, data indicates it triggers a cascade of biological responses. It's not just feeling bad. It leads to measurable increases in stress hormones, cortisol, systemic inflammation, and specific proteins, ADM, ASGR1, directly linked to cardiovascular damage and higher cholesterol. This indicates that loneliness is a physiological stressor akin to physical stressors. This shifts the understanding of loneliness from a social welfare issue to a critical public health concern with direct, quantifiable physiological impacts on the heart. It suggests that interventions to combat loneliness, example, community programs, social support initiatives, should be viewed as cardiovascular disease prevention measures, similar to diet and exercise. Loneliness can also lead to unhealthy behaviors like overeating, smoking, or excessive alcohol consumption, which further compromise heart health. Social relationships play a crucial role in well-being and can boost the immune system, reducing the risk of heart disease and stroke. Having a strong support network can reduce stress levels and a risk of heart disease. To combat loneliness, actively seek out connections. Make daily connections, expand your support network. Find new hobbies or activities, volunteer, or join support groups. Even virtual connections can be valuable. If feelings of loneliness persist, consider seeking help from a counselor. The data clearly links loneliness, a mental, emotional state, to an increased risk of heart disease and stroke, physical health outcomes. This strengthens the mind-body connection concept. The lack of emotional regulation support and unhealthy coping mechanisms then illustrate how psychological distress translates into physically detrimental behaviors. Healthcare providers should consider assessing social connectedness as part of routine cardiovascular risk assessment. Addressing mental health and social well-being could be a significant yet often overlooked avenue for improving cardiovascular outcomes. This also emphasizes the need for integrated care models that consider both psychological and physiological factors. Surprising risk factor 4, the invisible threat of air pollution. While we often focus on diet and exercise, the quality of the air we breathe is also a significant risk factor for cardiovascular disease. Air pollution, especially fine particulate matter, PM 2.5 from sources like vehicle exhaust, is a major contributor to atherosclerosis and cardiovascular disease. The MESA Air study, a decade-long research effort, directly linked long-term exposure to air pollution with faster plaque buildup and premature aging of blood vessels. Ultrafine particles in polluted air induce oxidative stress and systemic inflammation throughout the body. This inflammation promotes the modification of bad LDL cholesterol, making it more prone to accumulating in artery walls and forming plaque. PM 2.5 exposure can increase bad LDL cholesterol and impair the function of good HDL cholesterol, making it less effective at removing fats from arteries. Air pollutants damage the lining of blood vessels, endothelium, making them stickier and more susceptible to white blood cell infiltration, contributing to plaque formation. In severe cases, pollution can make plaques unstable and prone to rupture, increasing the risk of heart attack and stroke. Long-term exposure to particulate matter and nitrogen oxides can lead to faster calcium buildup in the coronary arteries, restricting blood flow. The MESA Air study indicated that the higher the exposure, the faster the atherosclerosis progressed, and that even levels approaching the National Ambient Air Quality Standards, NAQS, could prematurely age blood vessels. This shows a clear dose-response relationship, indicating no safe threshold for air pollution when it comes to cardiovascular health, or that even legally permissible levels still pose risks. This has significant public health and policy implications. It suggests that merely meeting current air quality standards may not be enough to fully protect cardiovascular health. Advocating for stricter regulations and continuous efforts to reduce air pollution sources. It also encourages individuals to take personal protective measures, even on unofficial unhealthy days. While it's difficult to completely control outdoor air quality, you can take steps to reduce personal exposure. On high pollution days, it's advisable to stay indoors, reduce outdoor air infiltration into your home, and use air purifiers. Limit physical exertion, especially outdoors and near busy roadways or sources of air pollution. When driving, keep windows closed and use the air recirculation setting to avoid vehicle exhaust. Avoid wood smoke, tobacco smoke, and other sources of airborne particles. Surprising risk factor 5, autoimmune diseases and your heart. Though not widely recognized, having an autoimmune disease significantly increases your risk of cardiovascular disease. Autoimmune diseases, such as rheumatoid arthritis, RA, lupus, or psoriasis, occur when the immune system mistakenly attacks the body's own organs and tissues. Approximately 8% of the US population has an autoimmune disease. The primary link is chronic inflammation. The persistent, systemic inflammation characteristic of autoimmune diseases can damage the heart and blood vessels over time. This inflammation contributes to atherosclerosis, accelerating plaque buildup in the arteries. Studies show that heart attack survivors with autoimmune diseases are more likely to die, develop heart failure, or have another heart attack. A large UK study found that having one of 19 different autoimmune diseases increased the risk of cardiovascular disease to a degree comparable with traditional factors like smoking or type 2 diabetes. This means that the chronic inflammatory burden of an autoimmune disease is equivalent to major, well-established cardiovascular risk factors. This isn't just an additive risk, it's a major risk factor in itself. This demands a paradigm shift in how cardiovascular risk is assessed and managed for individuals with autoimmune diseases. Healthcare providers must actively screen and aggressively manage cardiovascular risk factors in this population, recognizing that their autoimmune condition itself is a significant independent driver of heart disease, comparable to smoking or diabetes. A particularly striking finding is the significant sex difference in cardiovascular mortality among individuals with autoimmune diseases. Women with common autoimmune diseases may face a higher heart disease and stroke mortality rate than men with the same conditions. For instance, women with rheumatoid arthritis are 3 times more likely to die from heart disease than men with RA. This disparity highlights the need for tailored prevention strategies for women. The fact that women with autoimmune diseases have significantly higher cardiovascular mortality than men with the same condition, with rheumatoid arthritis showing a 3-fold increased risk in women. While the fact is clear, the underlying reasons for this disparity are noted as relatively unexplored and require further investigation. This points to a critical knowledge gap. This disparity suggests that the current understanding of cardiovascular disease in the context of autoimmune conditions might be male-centric or incomplete. It calls for targeted research into sex-specific mechanisms and manifestations of cardiovascular disease in autoimmune patients, and for the development of sex-specific screening and treatment protocols. For patients, it means women with autoimmune conditions must be especially vigilant and advocate for comprehensive cardiovascular risk management. Many people with autoimmune diseases are unaware of their increased cardiovascular risk. It is crucial for individuals with autoimmune conditions, especially women, to proactively manage their heart health. This includes regular screening for blood pressure, cholesterol, and diabetes, and working closely with healthcare providers to address all risk factors. Biologic therapies used for autoimmune diseases can help reduce systemic inflammation, which in turn can benefit cardiovascular health. Summary of surprising risk factors for cardiovascular disease. Unexpected risk factors for cardiovascular disease include sleep disorders, poor oral health, loneliness, air pollution, and autoimmune diseases. Sleep disorders, particularly sleep apnea, can lead to high blood pressure, increased stress hormones, and inflammation, exacerbating traditional cardiovascular risk factors. To mitigate this risk, prioritizing 7 to 9 hours of quality sleep nightly and improving sleep hygiene is crucial, along with seeking diagnosis if sleep apnea is suspected. Poor oral health, especially gum disease, allows bacteria to enter the bloodstream, causing systemic inflammation and accelerating atherosclerosis, potentially leading to direct heart damage. Maintaining good oral hygiene through regular brushing and flossing, routine dental visits, and a healthy diet are essential steps to protect the heart. Loneliness and social isolation can induce chronic stress, leading to an increase in inflammatory proteins and unhealthy coping behaviors, all negatively impacting cardiovascular health. Nurturing social connections, seeking support, and engaging in community activities can help mitigate these risks. Air pollution, particularly fine particulate matter, triggers oxidative stress, inflammation, and blood lipid changes, damaging blood vessels and accelerating plaque buildup. To reduce exposure, monitor air quality, limit outdoor activities on high pollution days, and minimize exposure to sources of pollution. Finally, autoimmune diseases cause chronic systemic inflammation, accelerating atherosclerosis, and significantly increasing the risk of cardiovascular events. This is particularly concerning in women, who may face higher cardiovascular mortality rates. Regular screening and aggressive management of cardiovascular risk factors, in conjunction with discussions with healthcare providers, are crucial for individuals with autoimmune conditions. This report has explored 5 surprising risk factors for cardiovascular disease: sleep disorders, poor oral health, loneliness, air pollution, and autoimmune diseases. While less commonly discussed than traditional risk factors, these elements play a significant role in overall heart health. Cardiovascular well-being is a complex interplay of lifestyle, environment, emotional state, and underlying health conditions. Understanding these surprising connections empowers individuals to take a more holistic approach to protecting their hearts. To proactively protect your heart, prioritize quality sleep, maintain good oral hygiene, nurture social connections. Be aware of your environmental exposures. And if you have an autoimmune condition, discuss your cardiovascular risk with your doctor. Regular checkups and open communication with your healthcare provider are vital to ensure your heart receives the comprehensive care it deserves.